The liver is one of the most important organs in the human body. It performs over 500 vital functions. We need our livers to digest food, clean our blood, and fight off infection. We will delve into the anatomy of this remarkable organ. We'll explore its size, shape, and location. We'll also examine its unique structure and the intricate network of blood vessels and nerves that support it. The liver is a reddish-brown organ with a rubbery texture. It's the largest internal organ in the human body, weighing in at around 1.5 kilograms. The liver is shaped like a cone and sits on the right side of the abdomen, just below the diaphragm. It's protected by the rib cage. The liver is tucked under the diaphragm and nestled next to other organs. It rests on top of the stomach, right kidney, and intestines. While the basic structure of the liver is the same in men and women, there are some subtle differences. On average, men have slightly larger livers than women. This size difference is proportional to body size. However, the functional capacity of the liver is the same regardless of gender. The liver is held in place by several ligaments. These ligaments are crucial as they anchor the liver to the diaphragm and the abdominal wall, ensuring it remains stable within the abdominal cavity. Without these ligaments, the liver would be susceptible to displacement, which could lead to various complications. The primary ligaments include the falciform ligament, the coronary ligament, the triangular ligaments, and the lesser omentum. Each of these ligaments has a specific role in maintaining the liver's position and stability. These are strong bands of connective tissue. Connective tissues are composed of collagen and elastin fibers, which provide both strength and flexibility. The liver's connective tissues are particularly robust, allowing them to withstand the constant movement and pressure changes within the abdomen. This resilience is vital for the liver's function, as it processes blood and produces bile continuously. One of the most important is the falciform ligament. This ligament not only anchors the liver to the anterior abdominal wall, but also separates the liver into its two main lobes. The falciform ligament contains the ligamentum teres, a remnant of the fetal umbilical vein, which plays a role in the liver's blood supply during development. This ligament divides the liver into two main lobes, the right lobe and the left lobe. The right lobe is the larger of the two and is responsible for the majority of the liver's metabolic functions. The left lobe, while smaller, is equally important and houses several critical structures including the caudate and quadrate lobes. The right lobe is significantly larger than the left lobe. This size difference is due to the liver's need to accommodate various blood vessels and bile ducts. The right lobe also contains the gallbladder, which stores bile produced by the liver. The larger size of the right lobe allows it to perform a greater share of the liver's detoxification and metabolic processes. Besides these two main lobes, there are two smaller lobes, the caudate lobe and the quadrate lobe. The caudate lobe is located on the posterior side of the liver, near the inferior vena cava. It plays a role in the liver's blood filtration process. The quadrate lobe, situated near the gallbladder, is involved in bile production and storage. These are located on the back side of the liver. The positioning of the caudate and quadrate lobes allows them to interact closely with the liver's vascular and biliary systems. This strategic location ensures efficient processing and transport of blood and bile within the liver. The lobes are further divided into smaller units called lobules. Each lobule is a hexagonal structure composed of hepatocytes, the liver's main functional cells. These lobules are the sites where the liver's primary functions, such as detoxification, protein synthesis, and bile production take place. These are the functional units of the liver. Within each lobule, blood flows through sinusoids, which are small, capillary-like vessels. Hepatocytes line these sinusoids and perform various metabolic processes. The central vein of each lobule collects the processed blood and directs it towards the hepatic veins, which then return it to the heart. This intricate structure ensures that the liver can efficiently filter and process the body's blood supply. Fueling the factory blood supply to the liver. The liver is one of the most vital organs in the human body, playing a crucial role in various metabolic processes. To function effectively, it requires a constant and rich supply of blood. The liver has a unique blood supply. Unlike most organs, which receive blood from a single source, the liver receives blood from two distinct sources. This dual supply system is what makes the liver so efficient and capable of performing its numerous functions. It receives blood from two main sources, the hepatic artery and the portal vein. The hepatic artery is responsible for delivering oxygen-rich blood directly from the heart, ensuring that the liver cells have the oxygen they need to produce energy and carry out their functions. The hepatic artery carries oxygen-rich blood from the heart to the liver. This oxygen is crucial for the liver's metabolic activities, including the breakdown of nutrients and the detoxification of harmful substances. The portal vein carries nutrient-rich blood from the digestive system to the liver. This blood is rich in nutrients absorbed from the food we eat, including glucose, amino acids, and vitamins. The liver processes these nutrients, converting them into forms that can be used by the body or stored for later use. This dual blood supply is essential for the liver to perform its many functions. The combination of oxygen-rich blood from the hepatic artery and nutrient-rich blood from the portal vein allows the liver to maintain its high level of activity and efficiency. The liver needs oxygen to produce energy. This energy is used to power the liver's many functions, including the production of bile, which is essential for the digestion and absorption of fats. It also needs nutrients to produce proteins, process toxins, and create bile. Proteins produced by the liver are essential for blood clotting, immune function, and the transport of substances in the blood. The liver also plays a key role in detoxifying the blood, removing harmful substances such as alcohol and drugs. Additionally, the liver produces bile, which helps to break down fats in the digestive system, making them easier to absorb. The liver's ability to process and detoxify substances is vital for maintaining overall health. Without this function, toxins would build up in the body, leading to serious health problems. The production of bile is another critical function, as it aids in the digestion and absorption of dietary fats and fat-soluble vitamins. The liver also acts as a storage unit for various nutrients. It stores glucose in the form of glycogen, which can be released into the bloodstream when the body needs energy. It also stores vitamins and minerals, releasing them as needed to maintain proper bodily functions. Another remarkable feature of the liver is its ability to regenerate. When the liver is damaged, it can repair itself by regenerating new cells. This regenerative ability is crucial for recovery from liver injuries and diseases. In summary, the liver's unique dual blood supply from the hepatic artery and portal vein is essential for its many vital functions. From producing energy and proteins to detoxifying the blood and aiding in digestion, the liver is truly a powerhouse organ that plays a central role in maintaining our health and well-being. Nerves of the liver. More than just a filter. The liver is richly supplied with nerves. These nerves are not just passive conduits, they play an active role in the liver's complex functions. The liver is often thought of as a filter, but it is much more than that. It is a dynamic organ that interacts with various systems in the body, thanks to its intricate nerve network. These nerves come from the hepatic plexus, which is a network of nerves in the abdomen. The hepatic plexus is like a central hub, receiving and sending signals to ensure the liver functions optimally. This network is crucial for the liver's ability to process nutrients, detoxify harmful substances, and produce vital proteins. The nerves carry signals to and from the liver, controlling its functions. These signals help regulate blood flow, bile production, and the metabolism of fats, proteins, and carbohydrates. Without this neural communication, the liver would not be able to perform its essential tasks efficiently. The liver also has its own internal network of nerves. This internal network is like a mini nervous system within the liver itself, allowing it to respond quickly to changes in the body's internal environment. This responsiveness is vital for maintaining homeostasis and ensuring the liver can adapt to varying physiological demands. This complex network of nerves allows the liver to communicate with the rest of the body. Through this communication, the liver can influence and be influenced by other organs and systems, such as the digestive system, the endocrine system, and the immune system. This bidirectional communication is essential for coordinating the body's overall function and health. It also allows the liver to regulate its own internal environment. By monitoring and adjusting its internal processes, the liver can ensure it operates efficiently and effectively. This self-regulation is crucial for the liver's role in detoxification, metabolism, and the synthesis of important biomolecules. In essence, the liver's nerve network is a key component of its ability to maintain the body's internal balance and support overall health. Venous drainage, exiting the liver. After the liver has processed the blood, it needs to be returned to the heart. This is done through the hepatic veins. The hepatic veins are large veins that drain blood from the liver into the inferior vena cava. The inferior vena cava is a major vein that carries blood back to the heart. The venous drainage system of the liver is essential for maintaining normal blood pressure and circulation. Clinical significance: the liver's role in health and disease. Because the liver plays such a vital role in so many bodily functions, it is susceptible to a variety of diseases. These can range from infections, such as hepatitis, to chronic diseases, such as cirrhosis. Understanding the anatomy of the liver is crucial for diagnosing and treating these conditions. Early detection and treatment of liver disease are important for preventing further damage. Conclusion: the liver, a complex and vital organ. The liver is a complex and vital organ with a fascinating structure. Its unique anatomy allows it to perform hundreds of tasks that keep us alive and well. By understanding the liver's form and function, we gain a greater appreciation for this amazing organ. For more fascinating insights into the human body, subscribe to Joen Academy and continue your journey of discovery.